Hi, I am Dr. Manish Dubey. I am a urologist and a robotic surgeon. I've been working in this field for last 23 years and mostly serving the community based in Navi Mumbai. Nowadays, whenever we undergo a complete body health checkup, for anybody, any male who is beyond age of 45, you would really mostly find a test called as Prostate Specific Antigen, that is PSA in short, which is done very commonly. What does it mean? Does it always mean that prostate specific antigen is a test for cancer? Today I would like to tell you more details about prostate specific antigen. This is a test which is done to detect cancers, infection, and many times this test has not a very diagnostic value. So the commonest question my patients ask me, PSA, is it really worrisome if it is raised? Here I would like to really throw light on what are the implications of high PSA if you find that as an incidental report in your complete body checkup. First of all, there is no need to worry. PSA can be raised in infection. It can be raised if a person even has a normal enlargement of prostate gland. PSA is basically an antigen which is present normally in a person. So it is just a tool. It is not diagnostic, absolute diagnostic. The best way to know whether a person has a prostatic cancer is biopsy. But not everybody undergoes a biopsy if the PSA is high. There has to be a certain filter done beyond PSA to ascertain that the person definitely needs a biopsy to confirm the diagnosis. What are those? PSA has got its own refined values in form of free and total PSA. If free PSA is high, which means there is freedom from prostate cancer, which means there is infection more likely than cancer. If, for example, somebody has high PSA and a non-favorable free PSA, then what do? There is one more test called as MRI. Basically, more refined way of doing a test called as multi-parametric MRI. MRI has become so refined that it can avoid biopsies in a lot of men. But before all this, most important thing and which is remained throughout the centuries and time is digital rectal examination. What does that mean? It means the clinical examination which a urologist does in his office or an OPD, where he feels the prostate and finds out if there is any hardness or a nodule, which can lead to a suspicion of prostate cancers. In fact, there are many people who will have normal PSA but will have suspicious DRE. These are the people who need biopsy upfront. Because PSA is such a simple blood test, it can be used for screening of population who are more prone to prostate cancers, like people having their family histories of prostate cancer and people who have some symptoms of prostate involvement. Early detection of prostate cancers can really lead to good outcomes in this disease, and that's why I recommend people doing prostate specific antigens at a very regular period, mostly taking a cue from their own urologist or the general physician whom they are visiting regularly.